Hello everyone, this is the Average Pharmacist here, giving you guys another wonderful video, and just wanted to let you guys know, as I said before in my previous videos, the reason I made this channel was to inform you guys about different things that have happened throughout medical history, and also to let you guys know about the medications you take. So if you want to know about their side effects, how they work, just leave me a comment below, and I'll go ahead and make that my next video. So unfortunately, no one left me a comment about any medications they wanted to learn about. So I took it upon myself to talk about the Cova vaccine. So right now we have 3 COVID vaccines that we're using in America. We have the Pfizer vaccine, we have the Moderna vaccine, and we have the Johnson & Johnson vaccine. So we have these are 3 pharmaceutical companies that develop their own COVID vaccine. And instead of making just one long video talking about 3 different vaccines, I'm going to break it up in 3. So this video is going to be on Pfizer's COVID vaccine. Then my next video will be about Moderna's vaccine. And then the last video will be about Johnson & Johnson's vaccine. Okay, so let's go ahead and get right into it. So the coronavirus disease 2019, or COVID-19, it is an infectious disease caused by the novel coronavirus that appeared in late 2019. So this is a respiratory disease, and it can affect other organs also, like the liver, the lung, the kidney, the heart, and other organs. And we've definitely seen the devastation that the disease can cause within the last year, both here in America and abroad. So individuals that have COVID-19, they have many symptoms, and they can range from mild to severe. Symptoms typically appear 2 to 14 days after being exposed to the virus, and symptoms can include fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, nausea, and vomiting and diarrhea. So unfortunately, there is no medication to cure coronavirus. However, a few vaccines have been developed, and the FDA has issued an emergency use authorization to permit the use of these unapproved vaccines to prevent COVID-19. So as we discussed in my previous video with thalidomide, and if you haven't watched it, I recommend you watch the video and tell others to watch it just to be informed. But as I mentioned in that thalidomide video, it can take many years for a drug to be approved. You know, the FDA wants to make sure that the drug is safe and that it actually works. However, in an emergency, what the FDA will do, they'll make a product available to the public based on the best available evidence. And they're not going to wait for all the evidence that typically will be needed for an FDA drug to get approved. Okay, so we have this situation. We have COVID-19. We know, a lot of the issues it caused, a lot of the deaths and hospitalizations. So what the FDA did is they went ahead and allowed an emergency use authorization. So as I mentioned before, they're not going to have this, 5 to 10 year period where they're making sure the drug is safe and that it works. As soon as they have some good evidence that the drug works, and that it is safe, they're going to go ahead and release the drug for the public to use to try to get rid of this public health emergency. Okay, so the name of the Pfizer vaccine is the Pfizer-BioNTech COVID-19 vaccine, as you can see pictured here. So it's administered as a series of 2 doses, 3 weeks apart. Okay, so you get your Pfizer vaccine, and then 3 weeks later, you get your second Pfizer shot, and then that's it. So there are other vaccines out there that I mentioned, the COVID vaccines, but there's no data showing that they're interchangeable, meaning that, let's say I get my Pfizer vaccine, my second dose 3 weeks later, I'm not going to get Moderna, right? And vice versa. I'm not going to get my Moderna vaccine, and then my next dose is going to be Pfizer. There's no data showing that the vaccines are interchangeable. So if you get your Pfizer vaccine, you're going to get your 1 dose, and 3 weeks later, you get your second dose. And then that's it. And it's indicated for people 16 years and older. And the reason that it's 16 years and older is that the clinical trials used to evaluate the safety of people getting the vaccine, it was done in that patient population, right? 16 years and older. However, Pfizer is working on some clinical trials right now in children that are 12 to 15. So in the near future, it's probably going to be used in that patient population in that age. But for now, 16 and older is the age of who's going to be getting the COVID vaccine for Pfizer. So some adverse reactions that were seen in the clinical trial were pain at the injection site, fatigue, headache, muscle pain, chills, joint pain, and fever. However, a lot of times when we see these adverse reactions that happen in clinical trials, we kind of have to take it with a grain of salt, because when you do clinical trials, they're conducted under specific conditions, right? And those conditions, sometimes they don't mirror real life. So a lot of these adverse reactions we see in clinical trials, we note them, but it's possible they may be seen more or they may not be seen when we use them in public, just because clinical trials are kind of different than, our situations are different than real life in a clinical trial. Some patient populations may not even be in the clinical trial. And then that patient population, obviously, if you're going to be using it in the public, then that patient population will use the drug. So a lot of times in clinical trials, when we have that adverse event data, we're not going to say that, this can happen in real life also, because it needs to be used in real life for us to know about these, what adverse events it actually will cause. So the adverse events seen after the drug was authorized for use in the public is we did see some severe allergic reactions, including anaphylaxis and hypersensitivity reactions. So these are like rash, itching, hives, throat swelling. So I have it pictured here, the signs of anaphylaxis, and these are potentially life-threatening. So if you get a vaccine and you have some of these anaphylactic symptoms, your doctor is going to treat you immediately, okay? And this is why when you get your Pfizer vaccine, they make you wait in the clinic, the office, doctor's office, or the pharmacy. You're going to wait 15 minutes, okay, before you leave, because they're going to monitor you for 15 minutes. And if everything's okay, you don't have any serious adverse events, then you can go ahead and leave, okay? So other adverse reactions, some which may be serious, they may actually show up later after we have more widespread use of the vaccine. So right now we have a lot of people using the vaccine, but the use isn't, extremely widespread. So, we don't know a lot of these serious adverse events that the vaccine causes. That's going to happen through time and through when many more people get vaccinated, and then we can kind of get that data and see what some of the serious adverse events are. Okay, so the Pfizer vaccine is used for active immunization against COVID-19. So I do have a picture of active immunization, and what I want you to focus on is the artificial vaccination, okay? So that's the kind of artificial active immunization is through vaccination, okay? So basically what active immunization means is that when a foreign body, like a virus, when it's introduced into the body is going to make an immune response, right? And what an immune response is how your body recognizes and fights an infection. So when a foreign body or a virus is introduced into the body, what happens is your body kind of makes this immune response. And then what will happen is after that immune response, let's say later, the virus comes back, you won't be affected by the virus, right? Because your body already mounted an immune response to the initial virus that was received. So, for example, the flu virus, okay? If you get a flu vaccine, what they're going to do is they're going to take a dead version of the flu, they're going to inject it into you. Your body is going to mount an immune response, and this is how your body recognizes and fights an infection. It's going to go ahead and fight that dead flu virus. So later, what they hope is, let's say 3-4 months down the line, you are in contact with the flu virus. Since your body already made that immune response previously to that previous dead flu virus, it's going to go ahead and fight that new flu virus that was introduced to your body, and you will be immune from the flu, so you won't get the flu. So that's the purpose of vaccination. Okay, so that being said, the Pfizer vaccine actually works a little different. Okay, so a big misconception that people may told you or that may be out there is that the Pfizer vaccine contains COVID, right? And I can see why somebody would say that because the flu vaccine, which a lot of people get, it has the flu. However, the Pfizer COVID vaccine, it does not contain COVID-19, right? So I do have it pictured here, how the vaccine works and how the Pfizer vaccine works and actually what's contained in the Pfizer vaccine. So basically what the Pfizer vaccine contains is it contains a messenger RNA, which is mRNA. So what mRNA is that is genetic material that teaches the cells in your body how to make proteins that can trigger an immune response, right? If you're infected with the virus. So in the Pfizer vaccine, like I said, you're going to have this mRNA. It's going to get injected into you. It's going to go into your body. It's going to go into your cells. And it's going to make copies of a protein. Okay. So later, if you're exposed to coronavirus, hopefully you won't be, but if you are, these cells will be able to recognize this coronavirus and they'll know how to fight it because this messenger RNA, had helped them earlier. Okay. So when you get the vaccine, your body does respond to it, and it can cause those effects that I told you were those side effects that were in the clinical trials can cause those fevers and chills, right? But that's just showing you that the vaccine is working, right? And it is, normal. Okay, so after the mRNA kind of gives these cells these instructions, the mRNA is broken down. Okay, and kind of in a nutshell, that's how the Pfizer vaccine works. So, like I said before, there could be some misinformation that, they're injecting you with COVID. They're not. The Pfizer COVID vaccine is an mRNA vaccine. And like I mentioned earlier, that is just genetic material. It gets injected. It tells your cells how to make copies of a protein. So later, if you come exposed to the coronavirus, your cells know how to kind of take care of the virus. So, as I mentioned before, there is limited data on the Pfizer vaccine. However, all the scientific data that was taken into account, they took that into account, and it's reasonably believed that the vaccine may be effective in preventing COVID-19. Okay, so lastly, I just wanted to mention that there is a lot of misinformation out there on social media like YouTube, TikTok, Facebook, and others in regards to vaccines and coronavirus. So when it comes to kind of this medical stuff and medical advice, I would only suggest you take it from reliable sources like your doctors, nurses, pharmacists, hospitals, these kind of governing bodies that look over these diseases, and just be careful of the things that you read out there. Okay, and if you have any questions, like I said before, reach out to a healthcare professional, or drop me a comment below, and I'll try to go ahead and see if I can answer it as best as I can. So I know I like to keep my videos short. I know this video was a little longer than usual, but it was a lot of information, and I hope you guys enjoyed it. And if you did like it, I would appreciate it if you hit that like button. And if you wanted to know about another drug at a later date, because as I mentioned before, I'm going to make the Moderna video next, and then I'm going to do Johnson & Johnson. Then if you leave me any comments about a drug you want to know about, then I'll go ahead and make the video after. And that's it for today. I hope you guys have a great day.